Having a shared vision for the type of result that you want, the degree of change that you're comfortable with, and the amount of time that you have to dedicate to this process is really essential in the planning. What we're looking at really is the anatomy, not so much the age per se of the patient. Really, we can do facelifts in the 40s all the way to the 80s or 90s. It just really depends on how a person is aging and what the changes that are happening in their face at a given time. So one of the most common indications for a facelift in a younger patient is typically extreme weight loss. So when we have a patient who's lost 50, 60, 70, 80, I've had a patient that lost 100 pounds, even a person in their early 40s can see significant changes in their face where the elasticity, so the snap back of the skin after the weight loss, is not significant enough to overcome the stretching that occurred when the patient was heavier. So in situations like that, it can be very useful to remove some skin through a procedure like a mini facelift or a face and neck lift to make the face look sort of age appropriate or weight appropriate for the patient's new body. Keeping a facelift looking natural involves lifting not only the skin, but also the subcutaneous connective tissue layers and muscles of the lower face and neck. In my practice, we do a deep plane facelift. So that involves lifting the SMAS layer, the superficial musculoaponeurotic system, and platysma with the fat pads and the skin of the medial and lower cheek. That avoids the sort of pulled tight or windswept look that you see from skin-only lifts or from lifts that are horizontal in direction rather than vertical in direction. The single most important factor in considering when to do a facelift is when you have enough time to allow for appropriate recovery, activity restrictions, and healing such that you don't feel pressured by a very short timeline in order to really feel comfortable in your results. Most patients find that recovery after face and neck lift is much less involved and difficult than they think it will be. The internet, unfortunately, can skew our perception towards the most negative or the most extreme. And so patients will come in and sometimes report a story that they read online that was particularly challenging. And I try to reassure them that the overwhelming majority of patients have a smooth and relatively short recovery period with minimal discomfort and really very few bumps in the road.